Imagine that almost a liter of blood passes through your kidneys every minute. While you sleep, they continue to work nonstop. But most people only start caring for them when pain occurs, creatinine levels rise, or a doctor tells them kidney function is declining. What if a simple morning drink could help maintain hydration, reduce the burden on the kidneys, and reduce the risk of kidney stones? Today, we'll look at drinks that have been studied by scientists, uncover their mechanism of action, and learn who they are suitable for and who they can harm. Chapter 1. Why kidneys start to fail. Lack of water, excess salt, high blood pressure, diabetes, obesity, painkillers, chronic inflammation, smoking, lack of physical activity. Explain the structure of the nephron, blood filtration, and urine formation. Chapter 2. Drink number 1, plain water. The most important drink. Mechanism: increases urine volume, reduces salt concentration, reduces the likelihood of certain types of stones, maintains normal filtration. Explain the signs of dehydration. Chapter 3. Drink number 2, water with a little lemon. Doesn't cleanse the kidneys. However, citric acid increases citrate levels in the urine. Citrate can bind calcium, reducing the likelihood of calcium stone formation. Who is it suitable for and who isn't? Chapter 4. Green tea. Catechins, antioxidants, effect on inflammation. Why you shouldn't drink gallons. Caffeine. Chapter 5. Sugar-free cranberry juice. Debunking the myths. Doesn't work for everyone. May reduce the risk of some urinary tract infections in some people. Why sweetened fruit drinks are a bad choice. Chapter 6. Coffee. The unexpected part. Moderate coffee consumption doesn't harm the kidneys in most healthy people. Some studies even link moderate consumption to a lower risk of chronic kidney disease. But there are exceptions. High blood pressure, caffeine sensitivity, large doses. Chapter 7. Unsweetened kefir. The influence of gut microbiota. Why gut health is linked to kidney health. What the research says. Chapter 8. Ginger tea. Gingerol, Chagal's, anti-inflammatory effect. When is it best to avoid them? Chapter 9. Which drinks are harmful to the kidneys. Sweet soda, energy drinks, large amounts of alcohol, excessively sweet juices, very large amounts of drinks with fructose. Chapter 10. If your kidneys are already hurting, it's important to explain. Lower back pain doesn't always mean kidney disease. Real causes could be stones, infection, muscle pain, spinal problems. When you need to see a doctor immediately. Blood in the urine, fever, severe pain, swelling, decreased urine output. Conclusion: no single drink can cleanse the kidneys of toxins or cure kidney disease, but proper hydration, moderate consumption of healthy beverages, and a healthy lifestyle can help reduce the burden on the kidneys and support their function for many years. Call to action: if you drink even 1 glass of water today instead of sugary soda, your kidneys will thank you. And if you want to learn which foods are slowly damaging your kidneys every day, be sure to watch the following video. Chapter 11. The morning that saves the kidneys. Strong retention block. Now let's imagine an ordinary person. They wake up, immediately drink coffee, drink nothing else, then spend the rest of the day drinking tea, sugary drinks, and little water. At this point, the kidneys are working in overdrive. The blood becomes thicker, filtration slows, salt concentration increases, the risk of microinflammation increases. And most importantly, this doesn't happen overnight. It accumulates over months and years. Chapter 12. A simple morning routine used by nephrologists adapted. Not a cleansing, but a filtration support. Step 1. 1-2 glasses of pure water immediately after waking up. Why? Replenishes fluid loss overnight. Stimulates renal blood flow. Reduces urine concentration. Step 2. After 20 to 30 minutes, drink a light drink. For example, warm water, weak green tea, water with lemon. Important: don't mix everything at once, as it can overload the body. Chapter 13. Mistake number 1. Detox drinks. A very popular topic online. But the truth is, the liver and kidneys are already detoxing 24/7. Fat-burning detox teas often contain laxative herbs. This can lead to dehydration. And dehydration equals burden on the kidneys, not help. Chapter 14. Kidney stones, a hidden threat. One of the most painful processes. How they form. Excess calcium or oxalates. Not enough water. Urine stagnation. First, these are microcrystals, then sand, then stones. And a person may not feel a thing for years. Chapter 15. Drinks that can actually reduce the risk of stones. They don't cure the risk, but they do influence risk factors. 1. Water with lemon. Increases citrate, reduces calcium crystallization. 2. Pure water. The main factor is fluid volume. 3. Moderate tea. antioxidants, but it's important not to overdo it. Chapter 16. Signs that the kidneys are already overloaded. A very important block for retaining the audience. Morning facial puffiness, frequent nighttime trips to the bathroom, foamy urine, chronic fatigue, nagging lower back pain, blood pressure surges. But it's important to emphasize, these symptoms do not always indicate kidney disease. Chapter 17. Why kidney pain is often not the kidneys. Very important explanation. In 60 to 70% of cases, it's lower back muscles, spine, pinched nerves, muscle inflammation after exercise. Kidney pain usually occurs only with inflammation, stones, severe infection. Chapter 18. The role of salt and sugar. The two main enemies of the kidneys. Salt retains water, increases blood pressure, increases the load on filtration. Sugar increases the risk of diabetes. Diabetes equals the #1 cause of chronic kidney disease in the world. Chapter 19. A simple right day for the kidneys can be organized as a lifestyle plan. Morning, water. Afternoon, regular water drinking. Minimal sugary drinks. Evening, don't overload on salt. Avoid dehydration. Finale, strong ending. The kidneys are an organ that doesn't scream right away. They don't hurt in the early stages. They simply slowly fail to cope. And when symptoms appear, it's a sign that the process has been going on for a long time. But the good news is that they can recover. They are greatly influenced by lifestyle. Simple habits have a big effect.